Sorry for ignoring you there. I was finishing something up. That was very rude of me. Welcome. Do you have an appointment today? We're a bit busy, so. Okay, perfect. My apologies. Welcome and nice to meet you. My name is Dr. Kate. Yes, nice to meet you. I will be the practitioner today. You are here for just a basic medical exam, right? Because that is what I see right now on the time slot. Perfect. Can I just get a verification on your name and how that's spelled? Beautiful name. And can I get your date of birth? Wonderful. Now, all of that aside, can you tell me why exactly you came in today? Was there something that was bothering you, or is this a routine check and this is just your first time here? Okay, alright, well, I'm very glad it's just a routine check. Fortunately, those are my favorite to do. When I feel like I'm looking for something that's wrong, I always feel bad. So I'm glad that hopefully by the end of this, you'll just be sent on your merry way with no problems, right? Okay, perfect. Routine check. Okay, now before we begin, I have to ask you some basic questions, although we do currently have some answers on file already. Are you currently taking any prescription medication? Okay. What about anything over the counter? Okay. And how frequently do you take that? Okay. And what for? Okay. That's very normal. Yep, don't be alarmed. Alright, now let me just see. Okay, perfect. Have you visited a mental health specialist within the last 6 months? Okay. Do you wear contacts or glasses? And beyond a routine checkup, is there anything of particular substance that's worth noting? Any rashes, any bumps, itchiness, trouble using the bathroom, sleeping, anything of that nature? Okay. I know, always a bit invasive. Okay, and my final question. Do you find yourself having trouble sleeping? Okay. Okay. How many nights a week is that? Okay. Thank you for telling me. Perfect. So now let's begin with the checkup. I'm just going to move my keyboard. What's fun about these is that they're Bluetooth, so I can just move them out of the way. Okay, so my first check will just be of your face. Nothing too daunting. Are you currently wearing any tinted moisturizer, any sunblock, any makeup, anything of that nature on your face, even skincare? I do need to be wary of, just so like if you're a little oily or something, I can attribute it to that. Okay, perfect. Yeah, so sometimes some practitioners will choose to not do face exams, but I find them to be very important because we never really know what lies underneath. And do you visit a dermatologist? Okay, yeah, so especially if you don't visit a dermatologist frequently, you might miss something. So even though I'm not a dermatologist, I am familiar with your, well, not your face specifically, but the face, you know? Okay, perfect. So just look right at me. I'm just going to peek in right here and feel. First, I'm just going to feel right under your eye. Please do tell me if you are experiencing any irritation. Okay, can you look up for me? Yep, so I can just feel right here. feel the sides of your face, okay? So I'm mainly going to be feeling right here, right? Because this is where your tonsils are. I just want to make sure that there is really nothing going on there. Have you had your tonsils removed? Okay. Just to make sure it's not swollen. Have you been sick in the past couple of weeks? Even something like the cold again? Okay. Did you get your flu shot this year? That's fine. A lot of people don't take it every year. Okay. Although we do recommend it, obviously, but what can you do? Okay. I'm just going to feel up the sides of your face, kind of near your ears, so just let me know if you, once again, feel any pain. Now above your forehead. I'm just going to reach right behind your head and feel right at the base of your neck. Okay, I'm not feeling anything too crazy. Okay, now keep your eyes closed. I'm just going to feel your eyelids. Okay, your nose. Your nostrils. I'm just gonna take a peek in your nostrils if you don't mind. Trust me, hair is normal, so don't be alarmed. Okay, just don't move for me, okay? I'm just going to look right and just pull your nose up here. Okay, up on the other side. Yep, just going to feel right up here. Just look. Okay, very good. Sorry about that. Okay. And I'm going to feel your lips, so just keep your mouth closed for me. Okay, perfect. How did that all feel? Fantastic. Now, I'm just going to do some basic sensory tests. So, I want to see your ability to have a good sense of distance and where your body is located, right? So, I'm just going to hold my hand up here, and what I want you to do is I want you to take your hand and just touch the tip of my finger, okay? How does that sound with your hand? Yes. Does that make sense? So do not come any closer, stay exactly where you are, and be prepared to feel the tip of my finger, okay? Can you bring your finger to mine? Good. Again. Good. Again. Good. Again. Good. Again. Good. Very good. Now, I'm just going to cover one of your eyes with this eye patch and do the exact same test, okay? So, this may mess with your depth perception. Good. Okay. Now, again. Good. Again. Good. Again. Good. Again. Good. Now I'm just going to move this to the other side. Wonderful. Now touch it. Good. Again. Good. Again. Good. Again. Fantastic. Just going to remove that. So wonderful. You're doing amazing. Now we're going to move onto the, once again, face, but mainly eye portion. I'm going to blow air into your eyes, okay? And I want you to try and keep your eye open and not blink. it may be hard the first time, but the second time, I really need you to try your best, okay? Very good. Let's try it. Keep your eyes open, 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 open. Good. Now the other eye. Very good. A lot of people fail that test. So what I want you to do now is we will be using this once more. I want you to tell me where exactly you feel the air blow on your face. So close those eyes for me. Good. I'm just going to come in close with this air here and just blow it on different parts of your face, okay? Perfect. That was your cheek, your eyebrow, good, your chin, your forehead, your nose, and your ear. Perfect. You did amazing. So now we're going to move into the real portion of the eye exam. And we're just going to put this in your eyes. It's always a bit uncomfortable. I feel like you know what I'm about to do. And it'll allow me to see your eyes just a little bit better, okay? So, I'm just going to come in close. And can you take your fingers and just keep your eyes open? Yep, just force them open. Good, yes. Okay, ready? 3, 2, 1. Good, and very good. Did a wonderful job. Maybe a little blurry at first. Are your eyes adjusting again? Are they? Perfect. That's exactly what's supposed to happen. And now, I'm just going to do a very basic eye exam. So, I need you to not move your head and follow the light with your eyes. The light may be a little bright. Try your best, okay? I know it might burn a little, especially because of that serum I just put in your eyes, but it's necessary. Thank you so much. Can you focus on the light for me? Good. I know. Here, let's take a break. Is that causing irritation? Okay. Let's try again. Good. Please don't move your head. Good. Very good. Yep. Okay. Keep following it. I'm trying not to shine it directly in your eyes, but having it bright enough so it's easy to follow. Good. Now I need you to tell me, without moving your head once again, when the light enters your field of view. I'm just going to hold your face steady, okay? Very good. Very good. Very good. Sorry. I know it was in your vision a little bit there. Very good. Okay. Wonderful. Great. Great. Oh, perfect. Did fantastic there. We're going to abandon the light, but it's not forever gone. I'm so sorry. But I do need you to follow my finger. So this is the exact same original exam without the light, okay? So maybe a little bit more difficult, all right? So just look at the edge of my finger, right here, the tip. And try not to move your head, okay? tell me if the finger is closer or farther first. Would you say this is close or far from your face? Okay, close. Good. And here. Further. Good. Good. Let's cover one of your eyes. Do the exact same test. Closer or further. Closer or further. Good. Let's do it again on this side. Closer or further. Good. Closer or further. Closer or further. Closer or further. Wonderful. Fantastic job. Now, I need you to tell me when both of my fingers enter your field of view while looking at my nose, okay? So this exam, I use both fingers because without the light, it can be a little hard to tell, alright? So just look right at my nose and tell me when you notice my fingers, okay? Good. Stay right here. Or into my eyes, whatever works. Good. 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 Great. Good. Wonderful. Fantastic. Now I will have both fingers in your field of view and you're going to tell me which one is wiggling, okay? Okay, very good. Ready? Good. 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 Very good. Now, I'm just going to look to see if your eyes are dilating correctly. So, I need you just to look straight forward for me, okay? Good, 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 good. Okay. Alright. Alright. Yep, keep looking straight forward. Okay. Just going to put my gloves back on and I'm just going to look at the skin near your eyes, alright? I always have to take off my gloves and put on new ones, as that is standard protocol, but the gloves never like to work with me. And also, I don't have gloves here in my size. Isn't that horrific? I know. They only have ones for the male practitioners today. So, my hands look a little bit ridiculous. My apologies. Okay, so I'm just going to peel down the skin right there and just take a look. Take a look. Okay, I am seeing some mild irritation, but nothing out of the ordinary, really. Just stuff that we consider pretty typical. Especially for someone that maybe is not getting as much sleep. I'm really not seeing anything that should be a cause for concern. Okay, very good. And I'm just going to feel along your eyelids once again. After putting that light, your eyelids, want to make sure there is no irritation. Perfect. Absolutely wonderful. Now, Sorry, these eye exams are never ending. I'm just going to use these glasses to take a peek in. Can you look up for me? Good. Look down. Good. Look left. And look right. Okay. Once again with the light. Can you look up for me? And look down. And look left. And look right. Okay, wonderful. I can barely see from a distance with these. Ooh. Hey. Sorry, sometimes the light can make everything blurry. So now, I need you to tell me what you think this smells like. Okay? I'm just going to spray it in the air. And I need you to tell me what you think it smells like. Okay, try your best. It's a pretty standard scent though, so honestly you should be fine. Ready? Deep breath in. Exhale, good. Deep breath in. Exhale. Good. One last deep breath in. And exhale. What was that? Minty fresh. Fantastic. Yeah, so sometimes I go between different scents. Sometimes I'll bring out like vanilla, but I don't know, you seemed like a mint person. Was that a good guess? You would have preferred the vanilla. I'll keep that in mind. Okay. So now, I know that most practitioners would decide to do this maybe at the beginning, but not me. As you may have noticed, we don't have any separate nurses to come in and do vitals. That is all me, because this is a private practice. So I decided to do them at the end. I don't know, I feel like doing vitals at the start is a bit boring. I like to get to know you and chat with you a bit. Okay, so now let's just do, I say just, like it's small, but I'm sure you've done this a million times. I just need to lift your shirt for a moment, if that's okay. Great. Just going to lift your shirt. Okay, and deep breath in for me. And out. Good. Deep breath in. And out. And around your back. Deep breath in. Good. And out. Deep breath in. And out. Now, going to just hear your heartbeat, so please do breathe as normal. I know that can be a bit difficult because now we're manually breathing. Okay. Okay, very good. Now, let's take your blood pressure. Yep, can I have your arm, please? Thank you. Okay. Okay, very good. Let me readjust that for you. Hold on. Okay, let's try again. Can you not make a fist for me? Good. Yep, leave your hand open and flat. Very good. All right. That all seems as normal as can be. Okay, wonderful. I know I said that was going to be one of the last things, but I do need to check inside your ears, okay? So just turn your head to the side for me. I'm just going to go in with this light here. Okay, yeah, but turn your head to the side. Very good. Have you experienced any hearing problems lately? Okay, good. Alright, now turn your head to the other side. Very good. Okay. So now I'm going to whisper a word in your ear. If you could tell me the word, I'd greatly appreciate that. Okay, ready? What word should I pick? Okay, I have one. Computer. Computer was correct. Very good. Okay, so now that that is all settled, I think you're done. Let me go check. Sorry. I'm never entirely sure, but I feel like that's pretty good, right? You think I'd get used to this doing it every day. Okay, let me see if I've missed anything. Imaging. Do you want to get photos done today? Yeah, so it just go into your file for things like your facial structure, stuff of that nature. We don't always do it. Sometimes patients like to get it done if they're experiencing some abnormality they want to have documented, but I didn't see anything today, so okay. Alright, good. Alright, so very happy to tell you that everything seems as healthy as it could be. How about this? I want to send you home with a little bit of a goodie bag. I noticed, as you said, you've been having some trouble sleeping, right? Okay. And I did notice some redness in your eyes. Do you scroll on your phone when you're sleepy at night? Okay, me too. No harm in that. We're very similar. But it is technically bad for us, so I don't want to prescribe anything to you because I feel like you don't need it. But what I would say is I would recommend some over-the-counter melatonin. Melatonin is natural. Try not to overuse it. I would say just use it to try to fix your sleep schedule and don't get dependent on it, right? Get a small dosage. You only need something like 3 milligrams since you are not too familiar with melatonin. Oh, you are? Okay, well, just try to keep it minimal. Okay. And use that not as something to rely on, right? But use it as a sleep aid. What helps trick our brain is to have a routine set up. So before you sleep, maybe you play a certain song. I know it sounds silly, but these things trick our brain into falling asleep. So whether that's watching a video or watching a specific show right before you go to bed, that can be helpful to trick your brain into thinking, okay, it's bedtime, right? Okay. Very good. I do have some melatonin here. I don't want to charge you for it because I did say it was a helpful thing that I'm offering to you. So you don't have to take it, but it's free. So it's up to you. Okay, perfect. Here you go. Just take this with you. Okay, thank you so much for stopping by. I really appreciate you coming here. I know it's a bit unorthodox to visit a practitioner like me, so thank you for taking a chance. I do love positive reviews. I'm assuming your insurance covers this. Fantastic. Okay. Thank you so much for stopping by. I really appreciated getting to know you, and I'm very happy to send you on your merry way, happy and healthy. Okay. Thank you so much. Alright. Bye now.